Ladies and gentlemen, today we have the privilege of having Dr. Caroline Williams to be with
Yes.
us. She's quite a new distributor, very, very exciting. And she will tell you everything that she knows. How do you enjoy these patches yourself and to all your family member as well as all your patients? And Dr. Caroline is living in Las Vegas,
Mhm.
and I believe it is from the line of Pastor Ed Milot, right,
Mhm.
Pastor Ed?
Yes.
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 Yeah.
Okay.
Yes.
So, Dr. Caroline, take it away.
Well, I just want to say thank you for asking me to speak today. I really appreciate that. I appreciate your faith in me in regards to that. I'm just going to tell a little bit about how I got introduced to the patches, and as you mentioned, like what my experience has been thus far, because I am relatively new. I was introduced to the patches back in March, so only like a few months ago, not even 2 months. Basically what happened was I was meeting with a representative of another company, and I usually talk to her and see her monthly. And we were having lunch, and I was telling her about a case that was challenging. And I basically kind of broke it down for her. I said, look, I have this case. I have this patient who I can't get sleeping. He takes Ambien every night and maybe just sleeps about 4 hours. And then he's doing all kinds of crazy stuff, so clearly that's not a long-term solution. He had a number of other underlying issues, a significant amount of stress, some financial challenges, and a business deal that he was waiting on, coming to fruition, happening. And there was just a lot of mental and emotional stress as a result of that. He had also been exposed to mold, black mold. We had done some testing, and there was evidence that he had very high levels of mycotoxins in his blood. So that was part of his issue with sleeping as well, because he had sleep apnea because of the sinus issues. He would wake up, often during the night because he couldn't breathe. So, we have to look at all those underlying issues as to why this person's not sleeping, right? So anyway, so I was presenting this information to her, and I said, look, my nutrition works, my nutrition and herbs work, but my problem is I cannot get this person to be consistent enough with any kind of protocol for it to have an impact, so I'm just at a loss. Do you have anything? What's interesting to me is, in regards to me asking her, something just inside myself said, ask her this question, right? Because technically, what she's helping me with is the nutrition and herbs. So what else is she going to offer me? Logically, you would think not to ask, but something told me to ask her. So I did. I asked her, and then all of a sudden she pulls out these patches, and she's like, oh, okay, so he's got this issue, that issue, that issue. Okay, try these patches. Here's one glutathione, which of course, when you have a mycotoxin issue, one of the things that the experts will tell you is that you've got to increase glutathione levels to eliminate those mycotoxins. So that was one of the patches she gave me. So I was like, okay, this is great. She gave me another patch she gave me was the sleep patch, obviously, and then the Eon for the stress and inflammation. She also gave me X39 as well to try. So, and then, she was talking to me about the technology and how it works. And I didn't really have a lot of resistance around this information, because I just know, obviously with my credentials, right, I'm a chiropractor, that ultimately everything is about the flow of energy, right? That's why we're alive at all, right? Our physical bodies are channeling ourselves. And this is why, all healing is related to flow of energy. Eastern philosophy understands this. Obviously, acupuncture is aware of this as well, right? Acupuncturists. So needless to say, I didn't have any resistance around, hey, this is an energy patch. It has a specific frequency that it activates, and it's going to stimulate production of these things within you, which is ideal. There's no better pharmacy than your own body, in my experience. Okay. Your body self-regulates, self-heals, self-maintains. It can do it if it has the right materials, if the body has what it needs and we can get rid of what's interfering. The body can regulate itself. We call that your body's trying to reach homeostasis all the time, right? I call it a balancing act because your body's never really in homeostasis, but it hovers around there. At least it tries to, right? Everything's about balance. So health is about balance. So anyway, so she gives me these patches. I'm like, okay, I'm going to try these. So this person, I put glutathione patch on him, the sleep patch, and the Eon patch. Now, I didn't know anything about placement at this point. I just put them on him where I thought I should put them. So I applied the patches. He slept all night that night. Okay. He's a little skeptical. So the next morning he wakes up, he's like, I don't know if that's why. I was like, okay. The next night he just uses the sleep patch. That's it. He doesn't use the other two. Didn't sleep as well. Not as long. Okay. Slept some, but not as good. Third night, all 3 patches again. Slept all night. Okay, again, slept all night. Wakes up the next morning and goes, okay, there's something to these patches. And I was like, really? And he's like, yeah. He said, the reason I say that is because I fell asleep. Well, no, he said, I don't even remember falling asleep. And that like never happens. That like never happens. So that to me was like, okay, this is amazing, right? Very difficult case, at least in my experience. And we were able to get this person sleeping, and he even gave it credit for helping him sleep. And this is somebody who, you know, when in regards to what he said about falling asleep and not even remembering, this person is intentionally very physically active during the day, because as soon as he settles down, as soon as he's not doing something, he's in his head and he's like going over all the issues that he has. So he creates his own fight flight response and cortisol release, and that will prevent you from sleeping right there. So he kind of in his own mind does it to himself. And it's pretty obvious. And he would validate that as well. So obviously the Eon, the stress and inflammation patch, was hugely important for him in regards to this. Okay, so that's my initial experience with the patches, which I felt like was pretty significant. For myself personally, I used the X39 that she gave me. And then I just went ahead and decided to, after what I saw with him, I was like learning about these patches. I'm like, okay, I'm going to just go full force on this. I want to see what happens to me. Obviously, as you can see, I have a history as a competitor. I've very much understand how diet plays a role in your overall health. And certainly, you know, in terms of results, as far as like body fat and muscle mass and all those types of things. I lead a very relatively healthy lifestyle. And I have a lot of knowledge, right, as a practitioner. So I don't really have any major issues because of the life that I have led up to this point. I am 50. I'm a young 50 because of the investments that I've made in myself. Okay. So I just wanted to see what happened. So what was recommended to me by Ed and Lorenzo and Rick was start with the severe symptoms protocol and then move right into the cellular regeneration protocol. So that's what I've been doing. One of the things I noticed was when I went to the gym and I worked out, this was like pretty quickly, like right away. I went to the gym and worked out. I got like a pump in my muscles. And I know what historically I would need to do to feel that way. And I didn't do those things. What I would need to do in the past is either take pre-workout, which I don't take because I don't like how that makes me feel. So I don't take any pre-workout, or do something called carb loading. Carb loading, after a day after you carb load, you get a significant pump in your muscles. All the water will move into that muscle. Obviously, I didn't do those things, and I got that pump, which is pretty interesting. So in my mind, I would attribute that to the X49 based on what it does. Another thing that I noticed was certainly energy levels been better, more consistent. I started using the Alavita patch at night, not mainly because I wanted to see how that affected my sleep, because Ed had recommended that that actually can help with sleep as well. And it can also help with improvement of pineal gland function. Mine's calcified. They saw it via CT scan. So I'm like, okay, I want to see what kind of effect this has on my pineal. Started using it. The very next day after my first use of Alavita, my skin was super soft. And I was like, this is kind of interesting. And then I was like, well, let's see what happens the second day. Wore it again overnight, super soft again. I was like, okay, yeah, Alavita is definitely having an impact, because I'd already been doing all the other patches up to that point before I started the Alavita. So that was pretty noticeable. As far as with patients, I have started recommending the patches to patients. I recommended that they start with the severe symptoms protocol and then do the cellular regeneration. A lot of my patients that have been with me for a while, their health is also doing really well. They don't necessarily have any major issues, but they are investment minded where their health is concerned. So, and they want not just anti-aging, but if reversal of aging is possible, of course they want that. So some of my patients are just doing it for that reason. I also have somebody that I introduced to the patches that has leukemia. So he's still in his cellular regeneration part. So we're going to see how that impacts things where he is concerned. I have another patient who has Parkinson's. He has not started yet, but I expect that he will. I have another patient that's a diabetic. He's going to be starting the patches as well too. And he has some numbness in his right hand, and he's received numerous treatments for that and it has not improved. So I'm optimistic about seeing, well, how does the stem cell X39 affect that, along with some of the other changes that we're making. But I expect the X39 will speed up the process. So one of the ways that I'm looking at using this with patients is speeding up what we're trying to do. Because obviously with watching some of the information that David's gone over, the X39 accelerates the healing process. And that's what I'm trying to do with patients. I'm trying to, what I call, unburden and fortify them, so that as their body's recreating itself, because we're doing that all the time, that's what cell turnover does, that they become a healthier version of themselves, that their body is regenerating and rehabilitating their glands, organs, and tissues. And so I've been doing that with patients for a number of years, but I feel like this is potentially a game changer, because it can speed up that process. So I'm super, super excited to see what's going to happen with not only myself, but with patients. That's kind of my story up to this point. Like I said, I only started in March.
Dr. Caroline,
Mhm.
so you start giving it to all your patients and you share it with many of your doctor's friends as well, I believe.
Yeah, I have I have some doctors that are actually patients of mine. So yes, so that's a very easy way to introduce it, because they're my patients. So one doctor who's a dentist, another doctor who's another chiropractor, they have started on the patches. And again, they're both doing, you know, the severe symptoms and then the cellular regeneration after that. I have another doctor that came in to visit me the other day. He came in to kind of establish a relationship to mutually refer back and forth. But in my mind, I felt like he was there because I needed to tell him about the patches.
Yeah, of course. Yes. Well, Dr. Caroline Williams,
Mhm.
thank you so very much for sharing with us.